We are live today from Sakra World Hospital, Bangalore. We have with us our expert Dr. Nidhi Nandan, a senior consultant of OBG and Gynaecology, to discuss all your queries on gestational diabetes in pregnancy. Good evening, ma'am.
Good evening.
Welcome to our live program. Doctor, here are a few questions from our viewers. Let's start, ma'am.
Yeah, sure.
What is gestational diabetes?
Right. So, gestational diabetes is one of the most common health issue which can happen during pregnancy. Since the diabetes developed first time in during the pregnancy, hence it is called as gestational diabetes. It mainly happens due to the rising placental hormones, which prevent the body to utilize insulin effectively. And therefore, this results into the high blood sugar levels in the pregnant woman. Insulin is a hormone which helps in controlling the blood sugar. So if the body becomes resistant to it, the blood sugars start rising up in the body.
Okay, ma'am. How common is gestational diabetes?
So gestational diabetes is very common these days. We have seen that out of 4 to 5 per 100 women during the pregnancy, they get affected with the gestational diabetes. Uh, it happens mostly during the second trimester or towards the end of the pregnancy.
Okay, ma'am. What are the risk factors?
So most women who are at high risk they can have they are basically overweight or they are obese or their basal metabolic rate or index is more than 30. If they are known to have polycystic ovary syndrome, then also they are at high risk of developing gestational diabetes. If there is any family history in their first degree relative, that means in their mother, father, brother, sister, if they have diabetes, they are more prone to develop gestational diabetes during pregnancy. If any patient who had gestational diabetes in their previous pregnancy, again they have a risk of developing gestational diabetes. And or if there any patient who has delivered birth weight or baby which is having more birth weight, that is 4.5 kilos or maybe more than that, then again they are at risk of developing diabetes.
Okay, ma'am. So my next question is how to check whether woman is having gestational diabetes?
So, whenever the women come for the first time during their antenatal checkup, we normally check their blood sugar levels at the time of their booking blood tests. So, we do the fasting blood sugar and we do a 2 hours postprandial blood sugar. Along with that, we do offer, if we assess their risk factors, and because of that, we offer them routinely oral glucose tolerance test between 24 to 28 weeks to all the pregnant women to rule out any developing diabetes during the pregnancy. If they are known to have gestational diabetes in their previous pregnancy, so we offer OGTT a little early in pregnancy around 16 weeks. If that is normal, then we repeat again OGTT between 24 to 28 weeks. So along with the blood test, we routinely test their urine whenever they are coming for their antenatal checkup to check for any glucose present in the urine test.
Okay, ma'am. How does gestational diabetes affects pregnant women?
Mostly we have seen that if the women with gestational diabetes, they have a healthy pregnancy and healthy baby. But sometimes gestational diabetes during the pregnancy may cause complications if it has not been recognized early or it has not been treated. Gestational diabetes is mainly associated with high blood pressure or what we call as preeclampsia of the pregnancy. If the blood sugars are not controlled during the pregnancy, then the pregnant women are at increased risk of having an induced labor or having a cesarean birth. So in this way, it is increasing the risk to the pregnant women.
Okay, ma'am. My next question is how does gestational diabetes affects baby?
Right, so if there is a high blood sugar levels in the mother or the gestational diabetes is not well controlled, it can make a baby oversized, what we also call as macrosomic baby. The baby, when they are during the time of delivery, such large baby or big size baby, there is a risk of having a shoulder dystocia. What means is that the shoulder of the baby can get stuck at the time of delivery. Such baby may need more intensive care after the delivery, may need NICU admissions. And also we have seen that post delivery, the blood sugars can come down very sharply. So we need to monitor them. Such babies are also very prone to develop type 2 diabetes and obesity later in their life.
Okay.
So in this way, it's very important to control the diabetes during the pregnancy.
Okay, ma'am. Okay. How to manage gestational diabetes in pregnancy?
Right. So gestational diabetes, once it is diagnosed at the time of initial checkups, we recommend and we strongly say that all the pregnant women should regularly and more frequently come for their antenatal checkups. We do tell them the importance of having a healthy eating and having a balanced diet, cut down their carbohydrates and increase the portion of their protein intake. In case if they need to see a dietitian can help them choosing their food, what they like, and trying to balance their blood sugar levels in a healthy and stable levels. We also recommend that routine, regular 30 minutes exercise or walk after the meals helps in controlling the blood sugar levels. So that is again very important. Uh, it's also recommended that they should follow how, when we advise them how to monitor blood sugars at home. So we tell them that after before meal and after meal, make a chart, monitor their blood sugar levels and document it so that we know what food items or whatever they are eating, is that making their blood sugars level stable or it is making it high, and accordingly we may have to modify their care. Sometimes diet and regular exercise may not control their blood sugars. So in that scenario, we might have to add tablets or insulin to control their blood sugars. So that is one of the method. We regularly check up the pregnant women, and we also for the baby we recommend that they should come for the regular growth scan to check the baby from 28 weeks onwards every 3 to 4 weekly to monitor the baby's weight.
Okay, ma'am. Ma'am, may I know what is balanced diet, ma'am?
Balanced diet means that for the diabetic patients, we say that they should have in their plate 1/4 should be the carbohydrate and 3/4 should be the protein intake. So they should cut down their carbohydrate portion as compared to the protein portion. But along with that, they should also take some fat and protein to balance the less carbohydrate that they are taking.
Okay, ma'am. Okay. How does the patient with gestational diabetes in pregnancy delivers?
Right, so we assess every individual differently. There is an options discussed with them. They can have a spontaneous labor, they can have a induction of labor, or they can be delivered by cesarean section. It depends upon how much their blood sugars are under control. If their gestational diabetes during pregnancy is controlled on diet, we can await spontaneous labor for the pregnant lady to go into labor on their own. But at any time it looks like that gestational diabetes is not controlled or they are on medications to control the diabetes, then we may have to induce them at 38 weeks or deliver them by the cesarean section.
Okay, ma'am. What happens after delivering?
So after delivery, as we know that gestational diabetes goes away after delivery. right? So we stop all the medications if the pregnant woman is on the medications to control the blood sugar immediately after the delivery. We make sure that the baby is on the mother's side unless the baby needs any extra care in the NIC. We monitor baby's blood sugars after few hours of delivery because there is a risk of low blood sugar in the baby. We encourage breastfeeding uh, after the delivery as breastfeeding is safe in gestational diabetes. So we make sure that baby and mother have a good bonding. And we regularly, before discharging the patient, we check mother's blood sugar also and then advise them to repeat OGTT or oral glucose tolerance test after 6 weeks postnatally to make sure their glucose levels are under control.
Okay, ma'am. My last question is what are the chances of having gestation diabetes in future pregnancy?
So gestational diabetes have a recurrence rate, so there is a increased risk that it can develop in the future pregnancies. So it is really very important to counsel the patient at the time of discharge or whenever we are seeing in the postnatal clinic to make sure they are following the healthy lifestyle, they are eating healthy, they are maintaining their body weight, and they are doing regular exercise. All these things can reduce the risk of developing gestational diabetes in the future pregnancies.
Okay, ma'am. So, would you like to suggest anything, ma'am?
No, I as say that whenever you come to know that you are pregnant, and whenever you come first time to see us in the clinic, we as a clinician need to assess your risk factors, and accordingly we follow the routine checking of the blood test by doing blood test to check the sugar levels if there is any high risk factors, and if it has been diagnosed as gestational diabetes, there is nothing to panic about because gestational diabetes is very common in us Indians or any South Asians ladies, and we are very prone to develop diabetes during the pregnancy. But make sure that it is well managed during the pregnancy, and it can also be taken care at the time of delivery and postnatally. So we look, as it is a high risk pregnancy, so it is really important to follow what the clinician or the doctors says for the regular follow-up in the clinics, monitoring of the blood sugars, monitoring of the baby, and then postnatal care and annual checkups to make sure they do not develop type 2 diabetes later in their life.
Okay, ma'am. Thank you, ma'am. So, with this, we come to an end of today's live show. Thank you, doctor, for your valuable insights.
Thank you.
Thank you, viewers, for joining us. If you have any queries, you can leave a comment and our expert will answer them for you. Thank you, ma'am.
Thank you. Thank you.